Hi, my name is Aidan Crone. Today I wanted to talk to you about doctor-patient communication and patient adherence. The reason why patient communication is so important is without communication between both the doctor and the patient, nothing can get done. Because if the patient doesn't communicate effectively to the doctor what the issue is, the doctor can't make a sound diagnosis. And if the doctor doesn't communicate the issues or the treatment plan, the patient has no hope of adhering to the treatment plan. This is why I'm here to give you 5 tips and tricks on how to achieve better patient care. My first tip is to bring a list or even a bag of all of your medications that you currently take. This is because if the doctor and the nurse have all of the updated information about your medications, they can make a more accurate diagnosis and treat you better. This helps because if the patient is open and honest about all of the medications they take, the doctors and nurses can build a better path of treatment for the patient. My next tip goes along with my first. You need to be open and honest about all of your medications that you take and all of the things you do. Whether that be taking illicit substances or taking drugs that you're not supposed to take. This is because even if you might get in trouble, you have to tell your doctor if you are taking illicit substances or taking medications that you should not be taking, because the doctor can't make an accurate diagnosis if they don't know the whole picture. My third tip is to stand up for what you want. This means that if, per se, your doctor is trying to prescribe you a medication that you know causes you issues, make sure to stand up for what you want and tell the doctor that you have an issue with that medication. The doctor will not know if you do not speak up and tell them. This is so important because if the patient does not feel comfortable taking the medication, and the doctor doesn't know, the adherence to that treatment plan will be very low. This is why it's important to tell your doctor if you are uncomfortable taking any medication or doing any treatment. My fourth tip is to have a schedule for your medications. This doesn't have to just be on your phone as reminders or in your head. Oftentimes, these lead to low adherence because people tend to forget. An important thing that people miss is double dosing. Say you take your medication in the morning, but you don't remember that you take it later on in the day. You might take that dose again because you think, did I take that medication in the morning? Thus causing a double dose. This is why it's important to schedule your medications through a plastic pill divider or anything that might help you otherwise. My fourth tip is for those people who have to have their medications refilled on a regular basis. These are drugs like antidepressants or anti-anxiety drugs that need their doctor to reaffirm or readjust their medication in order to continue treatment. This is important because if you don't make appointments for your medications before they run out, they could have very bad side effects, such as antidepressants can cause very bad mood swings and depressive lows. This is why it's important to make sure that you schedule your appointments before your medications run out. My final tip is often the most important. If you can't afford your medication, talk to your doctor about cost-affording options. Many times the hospital has programs for people who can't afford their medication. Additionally, medications have a low generic brand cost version that you can take as well. This is so important because if you can't afford your medication, don't not take it because you can't afford it. Talk to your doctor. All of these tips and tricks that I have listed will help patients get a better treatment from their doctors. From standing up for what you want to cost-affording measures, make sure to be open and honest with your doctor to achieve the best patient care. Thank you.